Good morning, everyone. It is 8:30. I'll call today's meeting of the Clay County Board of Commissioners to order. The first item on the agenda is a approval of the agenda.
Madam Chair, I'd like to make a motion to approve the agenda.
Second.
Motion to approve from Commissioner Bear, a second from Commissioner Ebinger. Any further discussion? Any further discussion? Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried. Citizens to be heard. Are there any citizens in the audience wishing to address the board on any item that is not on the agenda? Seeing none, have we had any online correspondence?
We did, Madam Chair, I did have a email from Nicole Sanders from Birthright, if you recall, last fall. She came before this board and presented that they were facing some financial challenges and asked for support of the community. Ms. Sanders did send in another request to share this in front of the board, that they are continuing to struggle and they need some help, or they're close to shutting their doors. So if there's citizens out there that are willing to provide different items for them, it would be greatly appreciated.
Thank you. Next item today would be the approval of the payment of bills and vouchers.
I'll move to approve bills
Second.
for the vouchers.
We have a motion offered from Commissioner Krabanoff to approve the payment of bills and vouchers, a second from Commissioner Bear. Any further discussion? Any further discussion? Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried. The minutes from January 6th, 2026 were in the packet.
Madam Chair, I move for the approval of the minutes from January 6, 2026.
We have a motion offered from Commissioner Ebinger to approve the minutes.
Second.
A second from Commissioner Krabanoff. Any further discussion? Any further discussion? Any further discussion? All those in favor of the motion signify by saying aye.
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 Opposed, same sign. Carried. Item 2 on the agenda today is a request approval to purchase survey equipment.
Yes, good morning. So the item I have this morning is requesting approval to purchase survey equipment from Frontier Precision. Included in this purchase is 2 GPS receivers, data collectors, and a robotic total station. Just kind of a little bit of an FYI on what we use this equipment for. So this is used every day throughout the construction season and surveying. So this equipment is used in all of our surveys, as well as staking for construction projects. And then the robotic total station allows for greater precisions when staking, and then also allows to stake underneath bridges and in wooded areas where you don't get a GPS signal. And then the robotic total station can also be used to automatically scan and then also do stockpiles for all of our materials that are in our pits and at our highway department. I guess any questions? And then this would be out of the internal service fund. We replace this every 5 to 6 years. Last time we replaced it was 2019.
Thank you, Justin. The internal service is adequate to cover the cost.
Yep.
Any questions from the board?
Madam Chair,
Yes.
I would move to approve the purchase survey equipment from Frontier Precision in the amount of $124,023.63.
We have a motion offered from Commissioner Ebinger to make the purchase.
Second.
And a second from Commissioner Bear. Any further discussion? Justin, in regards to what we are putting into the internal service, will it need to be adjusted based on the cost of this purchase?
A little bit. So Lori handles most of that, but I will give her a life, and then for the most part, it has worked out really well.
Any further discussion? Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried.
Thank you.
Item 3 today is a request approval to refill the adult mental health targeted case manager position. Good morning, Quinn.
Morning, Madam Chair, Commissioners. Yes, I'm here requesting to refill our adult mental health targeted case management, or Rule 79, more commonly referred to, within our adult and behavioral health unit due to an upcoming retirement of a long-standing staff member. Many of you probably know her. She's been with us in this role for over 18 years and has provided highly specialized and consistent services to adults with serious and persistent mental illness here in Clay County. So just a little bit of context, this position plays a critical role in supporting individuals with complex mental health needs. The work focuses on care coordination, service planning, crisis prevention, and connecting folks to community-based supports that promote stability and reduce the need for higher, more acute inpatient stays or ER visits. So maintaining continuity in this role would be essential for positive client outcomes. This position does generate revenue through MA billing. We added a second Rule 79 case manager in the end of July of last year. You all approved that, thank you very much. The projected annual revenue at that time was $115,000. I looked at our actual revenues for 2025, and we do have a small state set rate decrease for that service. So I am lowering the projection to $106,000 for this to give you the most up-to-date and accurate information possible. While it is slightly reduced, the revenue would offset the cost of this new position. The incumbent's salary and benefit is budgeted into 2026's budget, so we will see cost savings as a result of that. Sorry, give you the exact dollar amounts here. So the incumbent's salary and benefits is $130,090. Her last day in the office will be March 12th, last day of employment March 27th, so we will have a little bit of that salary expenditure within 2026. So taking all things considered, there should be about $30,478 in savings, assuming the new person comes in at grade 18, step 1. I'm asking for this now, as there's a lot of institutional knowledge in this position that we would like to try and transition over to our other Rule 79 case manager and the new person coming on, but it is likely that refilling of this position will take about 5 to 7 weeks. So hoping to get approval today, but I'd yield for any questions that you have, knowing that we have some time.
Thanks. Any questions?
Madam Chair, I have one question. Do you need backfill on this?
I am anticipating internal interest, so I would appreciate backfill if approved.
And since we've hired that person in July, how's that person been working out? Are they ready to?
Really good, yep, they're building up a caseload. I think last time I checked, Kirsten said, I think they're at 8 or 9 already on that caseload. We're gonna very strategically transition some of the long-term folks off of the retiring staff's caseload onto the new case manager. So then when we bring on potentially a refill, if the board approves, then that person would be building a caseload and have consistency for the folks that we're serving now, and then build up a new caseload with a new person.
Perfect.
Commissioner Krabanoff.
Yeah, thank you, Quinn. Working with adult mental health and that group, I understand the high demand on this and certainly understand the urgency. And I hope with another new person, obviously they're going to both, well, it depends on the experience that comes toward the position, of course, but that they can grow into making that into 2 very efficient jobs as soon as possible. So anyway, thanks.
Commissioner Ebinger.
Madam Chair, I would like to just make a motion to fill the Rule 79 case manager with backfill if there's internal interest.
Okay, we have a motion offered to approve with backfill from Commissioner Ebinger
Second.
and a second from Commissioner Bear. The slot of these requests coming up, not just this one, but did all go through the PIC committee.
Oh, yes, thank you, yes, this did go to PIC.
Favorable recommendation. Any further discussion? Any further discussion? All those in favor of the motion signify by saying aye.
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 Opposed, same sign. Carried. Thank you. Item 4 today is the request approval to create a cadet program for the Clay County Sheriff's Office. We have Sheriff Empting with us today and Chris Martin. Good morning.
Good morning, Madam Chair, Commissioners. Thank you for having us this morning. What a cadet program would be, it'd be creating like another pathway to policing. This would be for college-age students who are in a criminal justice program, whether it be at Moorhead State, Alec Tech, wherever it would be. But we're looking for that individual that is looking to go into law enforcement. This would be a program that they would be able to see all aspects of the sheriff's office, not just one, not just patrol, but also investigations, civil, courts, things of that nature. They'd be able to help out during jury trials when we're short right now in the courtroom. We'd be able to use them as bailiffs. Currently, right now, if we're short, we have to pay overtime to our deputies to cover some of those court shifts. We'd also have them experience the jail as well. So it'd be something that they'd be able to experience all aspects, and I think it would be good for us as far as recruiting in the future, to where we are able to see how they operate and how they operate under stress, and we would be able to hopefully have that person go from cadet to deputy when they have completed their schooling and when they have taken their post-test. One thing up for discussion today is we did discuss this in PIC, but it's where to start this person on the grid. Generally, we don't start people below a grade 8, but I think this is one of those positions where we could start somebody at step 1, grade 1. And I did provide some wage calculator sheets in the packet as well.
Thank you, Sheriff. Questions? Yes, Commissioner.
Can you, a little more background on the cadet program? So what age is this group? And is there any type of background that they might have prior to starting?
Yeah, so they would be college aged, so anybody 18 and above. And the background would be we would definitely do a background check on them. And again, the schools generally do check backgrounds as well. So this is somebody that's going to be in a criminal justice program already. And we should be able to have a pretty good idea on what their background is. We have met with a couple of individuals already who's very interested in this program and would like to be part of it.
Yeah, just seems to make sense, a great way to feed the program and the work. Thanks.
Commissioner Ebinger?
Yeah, Sheriff, what kind of training would you have for these individuals within the department to make them capable in the duties you assign them?
Yeah, we would provide them some of our basic training that we would have, first aid, use of force, things of that nature, in hopes that they're not put in any type of situation like that. We're not going to have them have a taser on them or anything like that. Just some basic type things to start off with. You know, these are going to be people that are more going to be with a deputy, if they're doing a transport or directing traffic at maybe a parade in the summertime, things of that nature. That's what we're going to be looking for there.
We had the first 28 years I worked, I was with a department that had a cadet program. It was an excellent tool for recruiting and vetting people too. You'd have some kids that got in there that you knew you didn't want to advance, and you had solid reasoning behind it. So this sounds like a great idea to me. One more question: they will be uniformed in something that
Correct.
clearly distincts them from.
Correct. It will be uniformed. And the other thing I should mention as well is we're not asking for any additional funds for this. We did have a variable hour deputy indicate about a week and a half ago that he's not going to be able to work with us any longer. His full-time job is fairly busy now, so he's not going to be able to be with us. Therefore, we did budget for his salary for 2026. Therefore, we're not asking for any additional funds for this program. We would use those funds to cover the cost.
How many cadets would you?
We'd be looking for 3 to 4.
Okay.
Madam Chair, I have one question.
Yes.
So how long can a cadet be a cadet? Do they sign up to be a cadet, go through school, finish school, pass their tests, and then if they get hired, or can they still stay on as a cadet?
The ultimate goal is for them to pass their
Yeah.
test and then become a deputy with us, get licensed, become a deputy. That's the ultimate goal to the program. So you're only hoping, depending on what school they're going to, whether it's a 2 or 4 year school, that they're only a cadet for that period of time.
Further questions from the board?
I have no questions, but I'll make a motion, Madam Chair, to approve the creation of the Clay County Sheriff's Officer Cadet Program and establish pay to grade
To be.
step 1, grade 1? Is that?
Yep.
Second.
We have a motion offered from Commissioner Bear, a second from Commissioner Ebinger. Any further discussion? The motion reflects what we talked about at PIC as well. Any further discussion? Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried. Thank you.
Thank you.
The next item would be 5.
Thank you, Madam Chair and Commissioners. This is one program that the chief deputy has researched and come up with, therefore I'm going to turn it over to him. I just would like to voice my support for this as well. I think it's a good thing for the sheriff's office in the county.
Good morning, Madam Chair and Commissioners. So what you have in front of you is a joint powers agreement that the Minnesota BCA has come up with. They have a anti-heroin task force that we were notified about and would like to participate with. With the JPA, I did send it over to Mr. Melton last week, and he reviewed it and sent it back to me. The JPA would allow for us to be part of the task force, which would mean that we would have access to up to $5,000 in reimbursement funds per case for reimbursement of overtime while investigating heroin, opioids, or opiate investigations, which includes distribution and overdose investigations. Each case would have that threshold of $500,000 or $5,000 if approved by the BCA, which could go a long way for us for investigations. One thing that's not required is we don't have any additional cost to our agency to be part of the task force. We don't have any additional training that we would have to send members to participate with the task force. It appears to be a significant benefit for us to be part of the task force. And I'm open for any questions if you have them.
Any questions for Chief Deputy? Yes,
Yeah.
Commissioner Kavanaugh?
Yeah, it sounds like a very good opportunity. I'm curious, your association with the BCA now?
We are part of a couple of different task force with them. One is for juvenile investigations. Can't think of any other ones offhand that we have with them. We have additional BCA agents, 3 agents that are stationed at the LEC as well. So we have close ties with our agents from Minnesota.
Okay, yeah. Anything to strengthen the relationship?
Commissioner Ebinger?
Yeah, what other agencies are involved in this task force in the region?
So I'm not sure what other ones are involved in the task force, and it's a little bit different than what you would normally think of as a task force where you're working as a group for the investigations. Being part of this task force, we can operate individually and do our investigations and then submit the programs to the BCA so that they can review them. We don't necessarily have BCA agents working with us or other agencies working with us on the investigation.
Okay, so it's not like the old drug task force?
Correct.
Okay. Sounds like a good idea, and Madam Chair, I'd like to make a motion to enter into a joint powers agreement for the state of Minnesota's Anti-Heroin Task Force Program.
A second.
Motion offered from Commissioner Ebinger, a second from Commissioner Kravanoff to approve the request. Any further discussion? Any further discussion? Any further discussion? All those in favor of the motion signify by saying aye.
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 Opposed, same sign. Carried. Thank you.
Thank you.
Thanks, guys.
Item 6 this morning, the request approval of the electronic health record program. Trey in the hallway. Okay. James, can we take your item? We'll move to agenda number 8.
Morning, Madam Chair, Commissioners.
Good morning.
I'm here this morning to request permission to rehire an open position in our non-secure unit. We have staff that's moving to Bemidji, so I'd like permission to refill that. There was a wage calculator provided. Looks like there'll be a savings of about $2,900 between the new and old employee if it got refilled. And I believe Anna brought this before pick last week for me.
Yes. Any questions? There's a request with backfill.
It's just been by pick.
Yep, Anna brought it before pick last week for me.
Okay.
Commissioner Bear.
Madam Chair, I'll make a motion to rehire the open juvenile counseling position in the non-secure unit with backfill.
Okay, we have a motion offered from Commissioner
Second.
Bear, a second from Commissioner Ebinger. Any further discussion? Any further discussion? Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried.
Thank you.
We're a little ahead of schedule. Can we do committee reports? Commissioner Ebinger, can you start?
Sure. Okay, on the Wednesday, the 14th, I attended the Northwest Emergency Communication Board meeting virtually. We had election of offices for both the RAC and the board. Bruce Johnson and Jim Duckstead are chair and vice chair for the board, and Chris Mueller and Nancy Schaefer are chair and vice chair for the RAC. We also did committee assignments within the RAC and board, and I moved from the alternate representative on the legislative committee. I'll now be the primary representative on the legislative committee. We voted on meeting dates, and either the 13th of May or the 7th of, or the 8th of July, we will be holding a meeting in Fargo at the new Red River Dispatch Center to get a tour of that. Later that day, the following day, on Thursday the 15th, I virtually attended the Greater Fargo Moorhead EDC Executive Committee meeting. Had a discussion on cash reserves and got an update on decisions by the governance committee. There is a discussion on the West Fargo membership with the EDC. Their share of dues are being paid, or their costs are being paid by Cass County, and it is either going to take a change in bylaws or some type of investment from Fargo and West Fargo for them to be voting members. We also had a review of the retreat results from December and a discussion on the strategic playbook draft. Cass County, just before Christmas, did contact and meet with Joe and some of the executives, and they wanted to have a working written agreement that had state's attorney review with expectations on measurable items. They received the agreement. It was pretty extensive, and at this time, there's a discussion as to whether they can work something out with Cass County to sign it. If not, there will be, Cass County does contribute $2.5 million for the EDC and the chamber through the Innovate 28 program. So that's to be determined. Later that day, I attended the meeting for West Central Regional Juvenile Center. We had everybody had wanted to go over. We held it at the center. Wanted a tour. We got a tour of the secure detention, secure residential, non-secure and clips areas of the juvenile. Is very well received, and it's just a reminder to me we really have a professional team, and the people we have in there, including the teachers, are really committed to helping these kids and to being there for them. And I think we're all aware of it. I'm preaching to the choir here, but we're very lucky to have the leadership and the staff that we've got over there. Had a discussion on a law enforcement response to West Central Regional Juvenile Center, and that stemmed out of a kid who self-reported there on Cass County probation pickup, juvenile probation pickup, and he was there with his mother, and there wasn't a law enforcement agency to sign him in, and they contacted the probation officer. I'm sorry, it was a Minnesota pickup order. The kid's a resident of Fargo. Anyway, it led to some confusion, and I think what the solution we came up with is to get with Sheriff Empting and make sure that the deputies are aware if this need arises, somebody on duty can come in and sign them in. Reviewed the 2025 statistics and reviewed the draft of the budget. Also had discussion on the food service contract. It was updated, same as we've seen in our meeting. Later that day, I had two meetings for the library, Lake Agassiz Regional Library Board. The first was the Finance Committee meeting. We approved a list of authorized institutions, Bell Bank and Edward Jones. Reviewed draft of the 2026 final budget. Looked at designated funds and approved them. And we appointed a committee, which will be the Finance Committee, to address the issues that came up on a new formula. And we're going to start work on that immediately. Following that, we had the full board meeting. Welcome new trustees, Deb MacArthur from Monoman, Paul Reese from Polk County, and Terry Khalil from Becker County. And we had a review of the results of the Finance Committee, and they voted on the appropriate issues. We approved the 2026 board meeting schedule and board committee assignments. And Friday, on the 16th, Commissioner Bear and I both virtually attended. Because of weather, we weren't going to go to Becker County, but we had our Clay Becker Partnership for Health Community Health Board meeting. Had a review of all the documents that we needed to put the new committee together. They've all been signed and they're all official. Joint Powers Agreement, delegation agreements, and bylaws. Had a transition update. Brandon Nelson covered our financial review and our grants. Had a legislative update. We have ship memorandum of agreement with Partnership for Health in Prairie Lakes, which is the old coalition of all 4 counties. And we are going to continue and ship to work together as one. Clay Becker Partnership for Health official appointments. I was chair. Dave Meyer from Becker County is vice chair. We have a community member from Becker County. It's their turn to have it. And the appointed State Community Health Service Advisory Committee member will be Commissioner Bear. And that completes my report.
Thank you, Commissioner Ebinger. Good morning, Troy. Can we take your item? We'll start with item number 6, if you've had a chance to catch your breath. Item 6 is a request approval to purchase an electronic health record program for the Withdrawal Management Detox program.
Yes, good morning, Madam Chair and Commissioners. The first item I would like to discuss is we took this to PIC and we are looking for approval to purchase a electronic health record program for our withdrawal management detox program. We're currently using paper charting, and it is not ideal. I think at least getting into the 90s would be great, and we could hopefully move forward with that, make our program better. We are going to, I have talked to Public Health about the money available for this system, and there is money in the opioid funding to support this, so we're hoping to use that to get an initial start, and then after that we will put it into our budget each year. We'd be able to save some money because we wouldn't be paying into PHDOC anymore, so it should be.
Thank you. Did you want to comment on it? I know you gave us some good insight at the PIC committee. Green.
Improving to an EHR adds to safety. That's, as a nurse, that's my priority is client safety. And you have our paper charts, which are easily to miss things, whereas we get this written system, they have stops. So if they forget to put in vitals, it lets them know, and then they go back and then they make sure they do that. And there's just safety steps in play to ensure that.
There's a lot of check and balances.
Yes, to ensure, and that's where I look at it as the safety aspect for clients, and then it improves charting for our staff members too, instead of just handwritten.
Thank you. We talked about this at PIC. We really felt that adding additional controls in would lean to what you talked about. We talk about this being a leading facility throughout the state, and making sure we make this transition would make the most sense. I don't know if any of us have gone into our doctor's office in the last 20 years and had paper charting done, so I think it's justified. But any questions from the board? Yes, Commissioner Kravinoff.
Thank you, Troy. So I'm curious, money, you said you talked to public health about the opioid dollars. What kind of, how big is that pot of money left right now, or do you know? And then what kind of strain is that going to be putting on that fund for uses that?
Sure, the last number I got from them is that there's $338,000 in the opioid settlement.
Okay. And this program would draw from that continually?
No, it would be just a one-time $25,000 to get it started this year, and then we would incorporate that into our budget for each year following.
Okay, and I want to just come back, and that's great, I agree with all that. Tell me, I'm just going to read here. Funding would be provided by revenue loss due to uninsured clients. You were talking about having better records.
Yeah.
So tell me how that would
Sure.
work.
So when a client comes in from Minnesota, if they don't have any insurance whatsoever, what we have to do is we fill out a form. Say the client is from Becker County. We would send a behavioral health fund request form to them. They would get that person on insurance, and we'd be able to bill for that. Right now, because of the increase in the numbers we've had, we've missed a few of those throughout, whether it's because they, so many of them go back and forth from North Dakota, Minnesota, and it's sometimes hard to keep track. So I know there's revenue that we've lost because we did not get that completed. Right now, our nursing staff is doing that. My next item, if approved, would allow us to have somebody to track it every day and ensure that we wouldn't miss some of those payments.
Thank you.
Yep.
Additional questions? Yes, Commissioner Ebinger?
Madam Chair, I'd like to make a motion to approve the purchase of the written electronic health record program for the withdrawal management detoxification program utilizing opioid settlement funds.
We have a motion offered to purchase.
Second.
Second, the motion was from Commissioner Ebinger, second from Commissioner Bear. Any further discussion? Any further discussion? Any further discussion? All those in favor of the motion signify by saying aye.
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 Opposed, same sign. Carried. Thank you.
Thank you.
The next item would be, are you anticipating someone joining you for the next item?
No, I don't think so.
Okay, 7 would be the request approval to move the shared administrative assistant from a half full-time equivalent public health to 1 point full-time detox.
Yeah. To give a quick background on this, this was back in June, we came to board to ask for a administrative assistant to split between public health and detox because of our increase in numbers, and it's put a lot of pressure on my other case aide with the billing stuff. So we are asking that we be able to move her from half-time at public health, move to full-time in detox, and we would use her as a full-time employee.
Okay. Again, we did discuss this at PIC. It seemed to make the most sense, particularly as we look with the new director in public health, making sure that we have projects available for employees during that time. You can certainly use the help over at your facility, and it may seem to make the most sense. Okay. Questions?
I'll make a motion to move administrative assistant from a shared position with public health to a full-time detox employee.
Okay, we have a motion offered to approve from Commissioner Kravinoff, a second from Commissioner Ebinger. Any further discussion?
Just one question for Troy.
Yes, Commissioner Bear?
How many people are over there today?
We have 28 in the building right now,
And what's capacity?
32. We have a lot of discharges going on right now,
Yeah.
so that'll lower, but, yeah,
That was quite a jump from the last time you reported,
yeah.
which was what, only a week ago, or maybe two?
It can go, you know, we can be at 14 and the next day I get there, it could be 30. You know, so it goes up and down very quickly.
Any further discussion?
I do.
Yes, Commissioner Kravinoff?
So if we have a couple of minutes here, kind of tell us the other side of it. I mean, you're taking care of an acute stage when they come to you and getting them stabilized.
Yep.
Can you tell yet how your progress is going in keeping these people in for a little bit, or till they not only stabilize, but they become maybe interested toward treatment
Yep.
and a better outcome?
Yeah, we have quite a few clients right now out of the 28 that are awaiting. They've been there a week waiting for a treatment bed to open somewhere in the state. Our LADCs do an excellent job of working with these clients to try to get them into some type of program. I've got 3 people working toward peer support right now, variable hour for us. That'll be another additional thing because they'll be able to talk to the clients, having been through this whole process, knowing what, you know, is going to happen and stuff. And that really helps kind of calm people and get them into treatment. So, yeah.
The treatment facilities that you're able to steer toward, is that directed quite a bit by insurance, or is it just availability? Maybe it's a combination of both, but,
It would be a combination of both, but mostly availability.
okay.
Yep.
And you can use sites both in Moorhead or Clay County and Cass, or how's that work?
We work on getting people into treatment for Minnesota residents. North Dakota clients, they work with Southeast to get into a treatment program that they have or somewhere across North Dakota.
I see. So it depends where they came from.
Depends on where they're living, yeah.
Got it. Okay.
Sometimes you get people back and forth, you know,
Yep.
so.
Yeah. And I'm sorry, the waiting time is for treatment?
You know, it can vary. It can be a week or it can be a month, depending on a lot of the clients' past behaviors, past treatment programs they've been in, things like that. Sometimes it takes a while to get them into a program.
And so then, do they seem open to staying with you during that period? For the
Most of them, yeah. The ones that are long-term are at our place on a court order, so they understand that they have to be there.
Right. And do they receive some type of treatment during that time?
We don't provide treatment per se because that would be a different license, but we're always educating them. We're always working with them, trying to help them. We have a lot of educational material out there, things like that.
Yeah, all right. Thank you, Troy.
Yeah.
Thank you, Commissioner Kravinoff. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried. Thank you.
Thank you guys very much.
Thank you.
Going back into our committee reports, Commissioner Kravinoff.
Thank you, Madam Chair. January 15th was a Thursday, and we had our monthly Rethink Mental Health and Substance Use Prevention Coalition meeting. very well attended again. We always get about, I don't know, 30-plus people online, providers and other people that work in this area. The main subject, we had two things. We had invited Robin Lucky Saul. She's the prevention coordinator for the harm reduction division of Fargo Cass Public Health. And she really talked a lot about harm reduction and the misinformation that gets talked about it by the work they do. She shared many success stories. Their one big program that they have over there that we don't have in Moorhead is a syringe program where people can bring in, if they are willing, use needles and syringes and get new ones. 30 years of research definitely show by these people starting to come in, they become more open to changing their lifestyle and getting medical treatment as needed. Anyway, talked in and they have a syringe services program over there that is part of the North Dakota state law. There was a period of time in Fargo that meth pipes were being given out, but that no longer is the case. The other thing that they're doing on the Fargo side, just awareness, they have the Fargo Engagement Center. You know, it's been over by the Civic Center for quite some time, and in May they'll have the opening of their new building on 2001 First Avenue North, so that'll be relocating. On the Clay County side, Annabelle talked about the program, and on the Clay County side, I should say, we do not have a syringe pipe or pipe program. However, they do provide Narcan, fentanyl strips, and other prevention aids. And you know, the big thing here it's such a horrible thing to be in people's lives by this work. You know, it's keeping down on hepatitis C, HIV. There's a lot of different diseases that come from the use, and anything we can do to reduce those things are certainly large savings in medical costs. And then last, both mainly through Karen Niskorski, who leads this program, we came back to, and we talk a lot quite often, sources of strength. And this more works on mental health, about suicide prevention, and the great work that really is being done in the schools. Examples were work being done in the Moorhead school system involving 85 students and adults getting together. That was in November, talking about the sources of strength. The Holly students that have been part of REACH out there are doing a monthly campaign, advertising and bringing closer to the rest of the students about sources of strength. And then as well, they have weekly meetings. So just a lot of really high-level things going on. And then again, there's been a promotion within by 5 more to high students, getting and helping students be aware of the 988 number for suicide prevention. That's so important. We had some losses last year in the Moorhead School. It's tragic, and any work we can do to prevent and get down to 0, I think is worth a total effort. So after that, I had my monthly meeting with HRA and the housing. HRA is hanging in there, and thanks again for the support that we do, or the taxpayer does, and in their levy. They are operating now on about a net 0 on operation costs, which is awesome. They're really getting to a point where they're getting a stable group of people. They're working along with Sharon Imptig. I know you stated some issues on Ulen. I think that's really gotten straightened around. If you hear otherwise, let me know. But they were still at that point when they came to us a couple of years ago, in the fact that they didn't have any reserves. Well, they really don't have any reserves yet, but at the same time, we aren't going negative, which is great. And then, so all that was kind of in their reporting, and they went through their 2025 goals, you know, and they're doing good. And so far, anything with federal changes haven't affected them at all yet. Not saying it won't, but for now. And then once again, we talked about this when Dara was here, you know, for their monies, their federal dollars, they're being strengthened by the amount of work that they do. And it's the smaller groups that are, it seems to be, they're getting hit a little harder than the big operation that we do around, or larger operation that we do around here. So, and then the last, we ended it with just, and I don't know if this has already been approved, but the possibility of our group meeting with them in April. So that was brought up. All right, then on Friday, I had the Clay County Early Childhood Initiative. There was over 20 people online about that. Talked about coordination between a lot of, just a lot of different groups that are actively involved, networking, groups, things they do for youth development. And the big one coming up that the planning starting is going to be the Kids Fest over at the library. And, you know, they work with Safe Kids programs, other things for infants to youth age. One of the things that is being, because of funding cuts, West Central Initiative has helped pay for the coordinated job that Jodette does with this program. That funding has been cut out, unfortunately, from their, as loss of some of their funding. So the group as a whole is trying to find ways and sponsors now to rebuild that part. It takes away about, altogether this program is about $25,000 a year, and that will take around roughly $6,000 to $10,000 out of that. So be looking for sponsors and other sources to keep it going. It's a good group. I think it does great things for children's safety and well-being. So that's my report.
Thank you, Commissioner Krabanoff. Commissioner Bear.
Thank you, Madam Chair. On Wednesday, January 14th, I was at the Wild Rice Watershed District meeting where there was 3 permits. They were all tabled. Some of them are waiting for landowners to get together in the spring to discuss tile outlets. Then we also discussed the South Branch Wild Rice grade stabilization, which will be occurring in Hagen Township on the South Branch of the Wild Rice, where they'll be putting rocks in the river to see if we can get the river's bed to raise and stabilize the river backing up. So that was talked about. Hopefully that project will start in the spring or summer. That'll be the first project. There's about 7 or 8 more that might go on if this project actually works. That's pretty much what we discussed at that meeting. And then on Friday, the 16th, I was also online with Commissioner Ebbinger for the Partnership for Health meeting, which he explained very well. I have nothing else to add on that meeting. Those are my 2 committee assignments.
Thank you, Commissioner Bear. Last week, I attended the Personnel Issues Committee. It was a rather lengthy meeting, about 2.5 hours probably after we addressed the issues that came forward at this board meeting today. But one item of note, just trying to be cognizant of staff members' time. When we have a meeting like that, someone had shown up early and waited 2 hours. What is the efficiency of our department heads in doing that? And so we did have a long discussion about what the policy is for that, making sure that we have ample opportunity at committee levels to kind of jump into the weeds on some of the justification on new hires or rehires or all of those pieces. And, you know, I think we will have a discussion coming forward to the board later on, but you know, at this point, we were thinking maybe if it made sense to still have a vibrant conversation at a committee level on rehires, have rehires go to the consent agenda. And the reason is, you know, this board still has the opportunity to pull that information if you want more information. All of the you know, the PDQ information, the financial sheet will be in there on what the savings is, but we're just trying to figure out what is that, you know, modest level of allowing people to present and justify the replacement, but also understanding that they have time. And if meetings go late, you know, it can kind of derail things. Granted, any new pieces would still come to the full board for dialogue. You know, I'm not sure, Steve, if you wanted it to come forward with discussion at this point, if we want to do it on an agenda item later, but both Commissioner Campbell and I did, you know, talk for a long time about this, and this was our recommendation going forward. He regrets that he's not here, so he can't answer for it. But just, you know, not trying to circumvent the board in any way, but also trying to understand that if department heads come forward for a request and would have to wait for a lengthy amount of time, you know, justifying it twice that could take a long time is up to what this board's wishes are. Commissioner Abraham.
I agree. And I've expressed this before. Our employees' time, particularly our department heads, is valuable. And it's good that we give these things scrutiny and that we make sure that they're legitimate, and I think PIC does that. And I think if PIC approves to refill a position, not a new position, that's something that needs to come before the board. But if PIC agrees to refilling a position, it should be on the consent agenda, and the documentation should be there for everybody on this board to review, and they can pull it off consent if they have concerns. But that keeps our valued leadership in this county from having to come into 2 meetings, and sometimes it goes long, they miss other meetings, and they get backed up. So I think that was a good discussion, and it resonates with me.
Commissioner Kavanaugh?
Yeah, I'd echo that voice. I agree. We're asking for efficiencies from them. This is one way to help them with that. So we all read our packets, go in depth on it. So, and I trust, you know, the 3 years I've been here, I always trust the information that comes through PIC.
And as always, you know, this board has the opportunity to pull things off consent. I think in order to allow folks to come forward, you know, if something were to get pulled off, that's fine. We can probably just maybe have a standard that it would be before committee reports if they have, so they can plan to get here if they need to. But, you know, for instance, that meeting took over 2 hours Tuesday. We're talking about needing to have an additional one. And then the other, in January. And the other piece is because of paid family, we're seeing some things happen that need to happen quicker than maybe we realized before. And so we're just trying to figure out how that all works together. Trying to be more flexible on the PIC side so that we can get stuff to this board quicker for departments. Okay.
That sounds good with me, Madam Chair.
So Steve, maybe we should put that on the agenda?
I can have that on for next week.
Okay.
I appreciate the board's thought and conversation on this. I think that well served in having the policy addressed to make sure that we review every position to ensure that financially it makes sense to continue that. I also appreciate your willingness to look at it from the perspective of having department heads and supervisors sometimes sitting 2-3 hours for an item that takes you guys a couple of minutes to approve in most cases. So I'll add that to the agenda next week. So thank you.
Thank you. And I think it's important for folks watching. These are things that we weigh heavily every January, and so this is a review that we do periodically or yearly on how we approve it. And we've done such a great job in talking through these hires with departments during the budgeting cycle. It's not like we're not having conversation with department heads, and they're hearing our perspective several different ways. So. Okay. All right. The next day, I traveled to St. Paul. I had meetings as part of the Environment and Natural Resources Committee with the Director of the Board in Soil and Water Resources, John Jaschke, the MPCA, Commissioner Kessler, DNR Commissioner Strawman, and their teams, all of them. It really was in the weeds, but incredible meeting to really bring some concerns to the forefront that us at counties and planning and zoning and feedlot officers and McPisa, I guess, is the other one. That's planning and zoning. But anyhow, solid waste, rather. Really had a great opportunity to bring forward some concerns on some of the issues that we've seen, some of the dialogues that need to continue. We talked about the importance of being at the table, both early and before information goes out to the public, so that we also can learn how the different regulations and terminology will affect folks, so that we kind of avoid when things come out to the public and then 20 minutes later we have citizens wanting answers on that, making sure we're part of that dialogue. There's some verbiage in the wetland management and the WCA challenges or changes that we wanted to have some further insight on, and then PWI updates, shoreline management, and then obviously we're talking about solid waste policy and funding initiatives. DNR talked a little bit about how they had recommendations in the governor's budget. The governor's bill came out with $907 million, not identifying local projects in those pieces per se, but there is about $10 million in dam safety, and then I think was there $9 million in haz mitigation, and then about $5 million in C&D waste transition, and then $5 million is the LRIP funding. So good information there. Really grateful for the opportunity to go down for that. Also had a meeting with Winthrop. We had a great dialogue on making sure there's some text amendments to our bill language so that we can hit the ground running for the legislative session. Really great updates from them on the connections they've made. The next day I attended the MetroCog meeting. We did have the election of officers, and grateful for the opportunity to serve as chair and vice chair over the last 2 years, but also grateful for the opportunity for West Fargo and Horace to take that over. We had several amendments to the work programs. As you know, when funding shifts, there always has to be an amendment, so we're making sure to follow what the federal and state requirements are on that. So we did have a couple of amendments on that. And then we talked about that almost $1 million grant, the federal grant that will go towards making sure the network for blood and plasma delivery is swift. Again, thanks to staff for writing for that. That is a fantastic partnership with so many different people. And then this evening we do have the public meeting for the new mapping changes. Let's see. The comment period is still open, but the public meeting is at 6 p.m. at the Yumcomb Center for the PWI update. There's a handful of changes, properties, lands coming on to the map. Folks have the opportunity to attend that meeting this evening. And I believe that concludes my report. Correct, at 6 o'clock.
Yeah.
Yep. That concludes my reports. Steve.
Thank you, Madam Chair. Last Tuesday, participated in the PIC meeting, which has been well covered. On Wednesday, we had county management, had a couple updates, several updates from HR, IT, GIS. On the 14th, we met with Darren and Anna on a county HR issue. The 14th, participated in the Clay County Legislative Planning, which has been well covered. Also had a short meeting with our White Earth update, just representatives from Moorhead, DGF or Dilworth, and Downtown Moorhead Inc. Nothing new has come there. We're still waiting for the report to come to the casino in their second plan study. Later that afternoon, I had a meeting with Dan Mawley and Robert Wilson. Again, talked about staffing and also the hiring challenges that we have. Some of it's brought about by ourselves, by each doing a market study on random years, and so trying to determine if there's better ways that we can work together, specifically with the positions that are hard to hire for. On the 15th, set in some meetings with Darren and our labor attorney with union negotiations. That afternoon, sat as part of our MTCA Budweiser settlement funding, final recommendations for those dollars that we received, a little over $120,000 that have to be expended by June of this year, which here, some of the projects, it's kind of tough with the winter. And so I believe that we'll be having that come before the board here for your approval in the coming weeks. Friday, worked on some department head evaluations. And then just lastly, over the last couple of years, this board has allowed me to be part of the Futures Group through AMC with Commissioner Mojo's appointment to second VP. They generally don't allow to have two members from the same county as part of the Futures Committee. And so I was approached this past December about the possibility of working with MACA Professional Development. And this week, or on Friday, I was notified the executive board did approve that appointment with board approval. And so your request before you would be one I would send a withdrawal from the Futures, AMC Futures Group, and then receive approval to be part of the MACA Professional Development Committee.
We need a motion for that.
You did have a motion to put me into Futures, so if we could have a motion, that'd be great.
Okay. Well, I'll make a motion then for the Steve to withdraw and then be into the MACA group.
Second.
Thanks. We have a motion from Commissioner Krabanoff, a second from Commissioner Ebinger. Steve, we knew that you would be appointed to that because like we've said throughout the state, you are the best administrator in the entire state. So it's no shock to us that you were appointed to that and your leadership will be very valuable on that board. I'm just bummed that you can't explain to me what I need to do on Futures now, so. Any further discussion? All those in favor of the motion signify by saying aye.
Aye.
Opposed, same sign. Carried.
Thank you, board. That concludes my report.
Thank you. Brian?
Thank you, Madam Chair. Good to see everybody. I feel like I've been gone for a few weeks. I had some trial work come up, and then I just thought I would report. I had the opportunity last week to go to the National District Attorney Association homicide conference, which sounds a little bit ominous, but it's a very good conference with prosecutors from across the United States working on serious cases and some of the most severe homicides, and just talking through best practices, whether it's from jury voir dire through use of different electronic means and body camera, surveillance video, all those types of things. And I think mostly what I took away from that conference was it feels good to know that a lot of the work that we're doing here through our law enforcement and our prosecution office, that we're doing some of the those things that are right, that they're, some of the presenters had things and saying, make sure you're doing this, and those are things that we're already doing and talk about and discuss within the state of Minnesota often. So it was a very good conference and much appreciated to be able to have the opportunity to go to that and learn from that and see that. So I also wanted to mention, I think, as you may recall, late last year, Darren and I and Mark Sloan had meetings to discuss a lot more, how we're seeing a lot more data requests and public data coming in. So a week before last, I had a meeting with Jill with the assessors and Kimberly, and then ultimately also with planning and zoning. We had a pretty large scale request through a subpoena ducis tecum. So legal matters that we're not even involved in, but legal matters that are happening and requesting information, large volumes of information from the county. And all three of those departments did a great job of just making sure we had all the right data and right information to get turned over in a timely manner. So we're working through that now, but I expect we're going to see that a lot in the future for a lot of the data practices requests and those types of subpoenas. So the other thing I wanted to mention, I did have the opportunity a week before last to attend the State of the Cities breakfast put on by the Chamber.
And I came away from that, mainly I wanted to just say how much excitement there is. They had one of their largest ones, about 700 people, and the discussion, before the mayors came out, they had discussion of the projects that were of interest, and almost every single one of those projects are projects that this county and this board work on, and I just appreciated the work that all of you do to make those projects go. They discussed the diversion was one of the primary projects, and the work that I know Commissioner Campbell, Commissioner Everer, and I think several of you have worked on. There was water projects they were discussing that I know are integral and are part of it, and economic development that are going on. And then there was a discussion of public safety and the fact how well, and although they posted as cities, but they did give a shout out to the counties, but really it's the fact that we work SWAT together, we work bomb squad together, and then a large discussion of the 911 dispatch center that we have worked a lot on, or that you have worked a lot on. And then finally, one of the other biggest projects or discussions was the City of Moorhead development and the 11th Street underpass development. And so all of those just had such a footprint of Clay County and the work that all of you do. So I just want to say congratulations and thank you for your work, because although it was mostly about cities, it's definitely integral about the counties and the work that the county board and all of you do. So that was a good breakfast to go to. Finally, I wanted to mention that we had our first annual hot dish competition. When Rita had come and presented for United Way, I was thinking about the fact that, the Family Service Center had something going on with bake sale and the government center. We didn't really have anything here at the courthouse, and so I had asked probation, now that they're all located here, and then also court administration, if they wanted to have a little bit of fundraiser. And so we did do a cook-off, made hot dishes that everybody could sample, and then we had a voting app that we created so that people could vote. And I will say, unfortunately, the county attorney's office did not win, but we did find out that Dale Arnold is a very good cook, and ultimately probation won the first annual one, so he's got the traveling trophy. So we'll see if we can figure out to do a second one. I think we need to do more advertising, get it out more and everything. But it was fun, and we did raise about $500 for United Way that we're going to wait and save for Giving Hearts Day. So we'll make about $1,000 for them as when I talked to Rita, just a good start for this year of 2026. So it was a fun event. Thank you.
Fantastic, thank you. Darren.
Thank you, Madam Chair. I also want to, I appreciate the discussion that the board had on the refilling of the position process. I think it's going to be much more efficient and without sacrificing accountability, so I appreciate that. On the 13th, I already also attended the PIC committee, which has already been covered. On the 14th, I had a meeting with the deputy's business agent, reference ongoing discipline process that we're looking at right now. I attended the legislative update meeting, and in the afternoon I had a meeting with the sheriff and chief deputy. On the 15th, I had deputy negotiations. We're still trying to come to a tentative agreement with that one. Still a work in progress there. And then in the afternoon, I had a meeting with Lauren and Anna, reference the no tax on overtime, just to make sure that we're doing that correctly. On the 16th, speaking of data requests, I worked on a data request that came in, and as I was sitting here, we had another data request come in, so I think that's a good topic. And then on Friday, the 16th, I also worked on some performance evaluations. That concludes my report.
Thank you, Darren. Sarah? Anything? All right, that concludes the business of the board. We will meet here next Tuesday, the 27th. We are adjourned.